just heard reveille, which in the military they call that the rouse. And I remember whenever I was in the Lions Club summer camps, that's how they woke us up every morning, and I presume that's how they wake the military up a lot of times. Uh, Other ways they wake them up is just by yelling at them, I think, is in the main way. But the point of today's talk is basically to wake you up, to wake people up to the idea that your health is something that you cannot be walking around not paying attention to. The Buddha, they asked him once, he said, well, what is it that makes you, so wise or so great? And he said, it's because I am awake. I'm not any smarter than anybody else. I'm just awake. I'm paying attention, in other words. My dad used to have a saying. He said, "Son," he said, "you can sleep when you're dead. So, but until then, you need to be awake." And what I observe in America today is people are walking around like zombies, basically sleepwalking, not really aware of their health issues, what's being done about it. And I'll give you an example. Yesterday, I sat down with a new patient, and she was consulting us for her feet being numb and asleep, and it had been going on for 5 years. And so she hadn't really thought much about it, but as it usually goes, whenever a symptom gets severe enough, then you start to pay closer attention, which is how the body works. Sort of like a little child, first they'll kind of whisper, they'll say, "Hey mom, hey dad, I want this or that, I need something," and we'll kind of go, "No, not now, Johnny." And so they'll wait for a while, then they'll get louder and louder and more obnoxious until finally you have to pay attention to them. Your body will do the very same thing. You don't want to be sleepwalking through life. So she had been putting up with this for 5 years, and now she's got real problems on her, I started to say on her hands, but I guess it'd be on her feet. I'd asked her about some of the surgeries she's had. She said, "Well, I had such and such surgery." And I go, "What did they do?" And she goes, "Well, I guess they did this or that." In other words, she really didn't even know. I asked her about the medications. She wasn't as familiar with really what the medications were. It turns out one of her blood pressure medications, her blood pressure is the same whether she takes the medication or not. So why she's taking it, I don't know, and she certainly doesn't know either. But as we went through the consultation, and I just kind of slowly brought this to her attention, that it seemed that maybe she wasn't as aware of her health and her health patterns as she might be. Interestingly, she is as though she kind of came out of a hypnotic daze, and as we talked about it a little bit more, she acknowledged. She said, I have been just kind of tolerating things and have been really not paying attention for a long time, and I recently I had decided that I was going to do a better job, which is probably why she showed up in my office to be more proactive. But I actually asked her permission for me to help her wake up from this kind of hypnotic daze that she'd been into. And there are forces, let me just say, that want America at large to be kind of in a hypnotic daze. In Rome, they used to have a saying during the Roman Colosseum days, when they had the warriors out there killing each other for entertainment for the people. But the Roman saying was, give the people bread and a circus, and that's enough. In other words, just give them a little bit of food and give them some entertainment, and they'll put up with just about everything else. So in America, there's some of that going on as well. And the more, for example, the food industry, they have ingredients that they put into the food that actually make you crave food more. And so obviously the more food you crave, the more you buy, then the more they sell. The pharmaceutical industry, it's much the same. The whole process is generated or is created in such a way that people just kind of accept it without really questioning what they're taking or why, never bothering to read the side effects, looking at the inserts on vaccines, none of that. So people are just kind of in a very zombie-like fashion going through life. So this consultation with this lady actually took about 3 times longer than it normally would with a person that I would say is very self-aware and rather awake. So as she became more self-aware, we were able to actually have a very productive conversation. So why is this important for you? Well, chronic illness is a matter. The CDC says that at least 75% of chronic illness is just lifestyle and daily activities. Duke University did a major study, and they found that the number one cause of premature death is simply bad decisions. So a lot of these decisions that are not made consciously, they're very subconsciously, they're very innocent. You know, do I eat the donut or the carrot, so to speak? But these decisions basically do mount up over time. And so if you're asleep on health-wise, it's actually very, very detrimental. So so as you start to wake up emotionally, mentally, spiritually, it awakens you physically as well. I see it all the time. And with health, it's really, really important. Athletes are notorious for being very goal-oriented, driven to achieve a certain level of performance, and they are great to work with because they're very alert. They look at even the slightest little things. Does this improve my performance, or does it hinder my performance, right? And I have found that those patients that are alert and awake, and I always sit down with patients and like to ask, you know, I like to have 3 goals. If I can help you with this problem that you've come to me about, if I could help you with it, what are 3 specific activities or things that you could do easier or better? And invariably, if I get a very vague answer, it's like, well, well, no, I don't know. That's why I'm asking. But they're really kind of, a lot of people are kind of grasping at the air, like they don't really have any motivation to get well. Well, these are the folks that I find that either don't complete care, they don't follow recommendations, and the long and the short of it is they don't get the results that the person who can give me 3 specific goals. There's some people ask me, say, what specifically could you do easier or better? And they don't miss a beat. They say, well, I could garden, I could go for a walk with my spouse, I could enjoy my grandkids, I could travel, without being uncomfortable. All these are the people, whenever someone can be very succinct with why they want to get healthier and what really drives them, these are the people that really get better much quicker, and I love working with these types of folks. So the moral here, folks, is that you need to listen to your body. Don't ignore it. Don't cover up issues. When a person says, well, I took such and such medication, say, for my headaches, and they go, and that medication, it worked. What they're saying a lot of times is, it helped me ignore my problem. It covered up the issue, and the issue with that is, now that problem, the underlying, just like a child trying to get your attention, will have to resort to more drastic measures to really get your attention. So that's what your body will do. So when you say, I took that medication or that pill, aspirin or whatever, and it worked, and it allowed me to ignore my problem, you will have to deal with that problem at some point, and hopefully it's not a life or death issue when it does happen. So don't cover up issues. You should seek solutions, real solutions, not Band-Aids. Band-Aid is fine for a cut or whatever. But if it's if you've got a gashed open limb or something, you need more than a Band-Aid. So thank you for paying attention and listening to this video, watching this video. If you like this, please put a thumbs up on it and like the video and share it with others. I'm Dr. Dwayne Allison of the Wellness Center, and thank you for watching.